Okay, having seen a brief glimpse of agent-based modeling, I wanted to take a little bit of time talking about some of the basic features of these models. We're then going to talk about the broader context of the agent-based modeling process and a few pointers, and then we're going to dive into some of the modeling vocabulary we use, the basic building blocks we use to construct these sort of agent-based models, and a series of lectures that will take us through much of tomorrow. So within this lecture, I wanted to highlight some of the, and situate people, particularly those who have seen other sorts of modeling, with respect to some of the essential features associated with agent-based models. So within the context of our work, and within the context of AnyLogic and health science applications of system science more generally, there's three types of modeling that are particularly, system science modeling that are particularly notable for supporting dynamic modeling associated with health concerns. One of them, the one in which, around which our boot camp is organized, is agent-based modeling. A second one is system dynamics, and a third is discrete event modeling. I want to talk specifically about agent-based modeling here, and we're going to see glimpses about the two others that are supported within the AnyLogic platform later in the week. So agent-based models are distinguished by their focus at an individual, depicting the population at an individual level as composed of one or more populations, each of which is composed of individual agents. These agents are each associated with a set of characteristics and an evolving state. These characteristics include aspects of their sort of parameters. It's notable these can include both discrete quantities, such as gender, ethnicity, as well as continuous quantities, such as birth weight and income. This is not a trivial point. Within quite a few modeling frameworks, we're limited to characterizing discrete characteristics of individuals. I would highlight, for example, in aggregate compartmental models, system dynamics models. If we want to characterize a population according to something like age, or according to something like birth weight, or according to something like someone's length of time they've spent since they quit smoking, we can do that, but we have to divide that population up into categories, discrete categories. And here in an agent-based model, we can characterize people as being associated with continuous parameters as well. We could associate someone with a parameter that specifies, for example, their birth year, the time of birth, and from which their current age could be calculated as a continuous quantity. We often will also associate people with discrete categories where it's natural. So you have a greater specificity to specify characteristics that are natural for your situation, that match your needs. And that includes continuous quantities. We also have associated with each individual a state that evolves over time. That's kind of their current status, their current situation. And at the level of each individual, it's delineated in either a discrete way, such as with those state charts we saw, where people went susceptible, infected, recovered, and back again, or in a continuous fashion. So we could calculate, for example, someone's state in terms of their smoking status, current, former, never smoker, or we might do so in terms of their pack years smoked, for example, how many years they've spent smoking cigarettes as a continuous quantity. And these quantities might evolve over time as the agent's situation changed. There's rules for evolving this state that we typically specify. Now, where in that model we just saw, that first introductory model, where are those rules specified? Where are those rules for evolving the state? Anyone give me an example?
The
Yeah, and transitions. Those transitions declaratively specified a rule. You specified, and this is consistent with the philosophy of AnyLogic, which is consistent with this broad class of what we call declarative programming languages, the declarative programming systems, that you focus, when you describe the model, you focus on what the model should do and less on the how. Traditionally, agent-based models have been specified with lots and lots of code that specifies how the model should work, but it can often get in the way of understanding. And here, with AnyLogic, we try where possible to adhere to declarative specification mechanisms that let us say what we want this model, what characteristics we want this model to adhere to. For example, the fact that this rate transition, this transition from infective to recovered is associated with some rate of decay given by a certain rate constant. So it's associated with is exponentially distributed residence time while in the infectious state. And that implies a rule for evolving that agent. We had other rules that were specified in terms of contact that we didn't look into in as much detail. So we have these rules for evolving state, and then we have a means of interacting with other agents. How did the agents in that model interact with others? It was a particularly simple mechanism, and what was it? Yeah, the neighbors in the cardinal directions, they contacted the neighbors. And how they did it, it turns out, was through a thing called messages that we'll be seeing, maybe later today, maybe tomorrow. But there's this mode of interaction with other agents. In this case, it's neighbors. In general, it may be neighbors in space, neighbors in a network, connected individuals in a network. It may be anyone selected throughout the entire population, etc. Associated with this model is also some time horizon and characteristics, so a time unit, typically. Sometimes in general, in AnyLogic, we evolve this time in continuous fashion. We can impose the lockstep evolution of the model, which is traditional in many agent-based models, where the whole population is advanced in kind of time steps. That's also possible. And there's some initial state of the model. There's some initial situation. In this case, it started with one person infected. Now, for those, particularly, I know a number of people here come from a background of system dynamics models and in aggregate models of various sorts. And those models form a very important component of our modeling toolbox. They're models that we pursue on an ongoing basis in a number of different areas, and they're very valuable. In this case, our focus is going to be on agent-based models, and I want to distinguish these two types of modeling with respect to some important characteristics, because it's important for understanding some of the distinctive characteristics of agent-based modeling and relating the two models. I would argue that these types of models, stock and flow model on the one hand and an agent-based model on the other, have almost a depiction of a situation that's almost at right angles with each other, as we say, orthogonal to each other. In a stock and flow context, we have a model that depicts a population as divided into a set of categories, and at a high level, it may look very similar to what we've seen in the agent-based model. We have these kind of boxes which represent health categories, in this case, susceptible, exposed, infected, recovered. And we have these, what seem to be transitions going between them. So at a certain level, it seems very similar to what we've seen. But the model organization is conceptually very different. How it works is very different. Within an aggregate model, here we have each of these boxes, these stocks, these accumulations, counting at a given time the number of people in that category. So the number of susceptible at a given time, the number of exposed, number of infected, and the number of recovered individuals. And people flow between these categories, some number of people per unit time, say per day, 10 people get infected. This is in a classic stock and flow model. Here we're subdividing the model according to people's characteristics, in this case their state, their natural history of infection. In general, it might be their state, but also aspects of their characteristics, male versus female. We could We could further subdivide the model into susceptible males, susceptible females, exposed males, exposed females. We're subdividing according to their characteristics and counting the number. The data is the number of people in each category, okay? And we have people flowing between categories. Here, we're not really keeping track of whether it's the same people who are infective now that were infective, a year ago. We can't really ask that question in most cases because we're not tracking individuals. Everyone within one of these categories is assumed to be more or less interchangeable, and we're not able to ask, for example, show me a graph of the number of times people in the population have become infected. So in a stock and flow model, we're organizing it according to the state of the population and their characteristics, and it's counting the number of individuals with different characteristics. By contrast, within an agent-based model, here we're subdividing the population according to individual, to the actors involved, and each actor, rather than just keeping the count of people who are in a given state, each actor maintains information on whether they're in a given state, susceptible, exposed, infective, and recovered, for example. Each actor is maintaining their state. So it's almost, you take one, you flip it on its side. In the one case, we're keeping track, we're organizing according to state and counting the number of people in each category, that's the data. In the other case, we're organizing according to person, and the data is the state with which each person is associated with their other characteristics. Another notable feature is in an aggregate model, if we have quantities that are at different levels conceptually, say the susceptible, infected, exposed, and recovered people for a given city, and for 2 cities, and then for the whole population, they're just different variables within the model. Within an agent-based model, we actually have nested structures involved. So we have, for example, we might have individuals, and they can be nested in a city, and then a city within the broader population. We can have these successive levels of context that are captured within the model. They're captured in a way that mirrors the structure, mirrors the kind of hierarchical structure of the external world. So if in our external world we have a city containing people, so it can be in our model, and then we could have a province containing the city, for example. So these are some differences between aggregate and stock and flow and agent-based modeling depictions. Let's talk a little bit about these populations. So in our model, we're going to have a population depicted, and when we run our model, that population is going to consist of a wide variety of particular people. Each of those people will be associated with, say, some parameters that represent their characteristics that change less frequently. For example, their ethnicity, their sex, and their income. And if we look at a given time, a particular person here will be associated with a specific set of combinations of these. So, for example, this person here is a Caucasian male with a certain specified income, and another person in the population will have different characteristics. And here we'll specify their state according to a set of categories. We saw this in our previous model, and we have rules that delineate the evolution of that state as distinguished by these transitions. We can comfortably add in additional aspects of state in their evolution by adding additional state charts. And these state charts may be mostly independent of each other, but are not necessarily solitudes. For example, the occurrence of a person in a state over here with respect to their health, for example, in an infective state, may lead them to change state on the right-hand side with respect to care-seeking behavior. Okay, so here we can add in additional aspects of a person's status, additional aspects of how they change over time, with adding successive state in this case with state charts, and we can have interaction between those state charts to capture different aspects of a person's evolution. I would contrast that to the situation within a stock and flow model where if we want to capture two different types of evolution within the same model, it blows up the size of that model correspondingly in sort of a combinatorially prohibitive way. So in other words, if we want to distinguish people by diabetes status and then by TB status atop of that, now you're talking about needing to multiply the number of states in that model, the number of those boxes, the number of those accumulations by successively larger factors. And so it can easily accumulate a massive number of divisions because you've got to deal with all possible combinations of states you could be in. That I'm uninfected with TB and I am in a normal glycemic state. I'm latently infected with TB and I'm in a normal glycemic state. I'm latently infected with TB and I'm in a pre-diabetic or a fully diabetic state, etc. And you have to consider all possible combinations. Here you can describe them in a quite compact way with successive state charts and allow for surgically certain interactions to be captured between those state charts. There's means of interaction of these agents, and we see them here depicted in networks. In the previous model, we saw it depicted in space, so people interact with people next to them in space. But we also might want to make use of one or more network structures atop of that. And here, as a result of our ability to place people in a situated context in space or context in a network, we can capture aspects of emergence that are difficult to capture in a stock and flow model. For example, emergence over not only over time, as is typical in stock and flow models, but over space and over networks. So, for example, we can capture the buildup of contaminants within certain ranges of the space, whereas in other areas it's less pronounced. We can capture multi-stage waves of infection that we've just seen. These are emergent patterns, but they would be elusive to capture within a stock and flow model because you're not able to recognize what's occurring in a fine-grained level in different areas of the space. Here we have the depiction of a population divided into networks, and we see that if we look at the network structure, those who are in more crowded areas of the network are more likely to have gotten, in this case, it's a spread of infection, but could be spread of ideas, diffusion of innovation. And those in less crowded areas of the network are less likely to get infected. So we can capture spatial and topological connectivity-related dynamics. In contrast to stock and flow models, agent-based models are typically stochastic in nature. So we had that in a previous model we looked at. We had that expanding periphery where it was kind of ragged at the edge. And this reflects the fact there's uncertainty associated with these models. And to ensure that the model results that we really understand the model results and that what we've seen is not merely a fluke of one particular run of the model, we typically have to run the model many times. And so in a given run of the model, we might get a certain outcome at the final time of the model with respect to quantities of interest. In this case, maybe it's the number of people who have contracted an infection over the course of the model in different communities. But if we run the model many, many times, we'll see that actually there's distributions associated with these. So we'll run it a variety of times, and we'll see that, for example, in most cases, the burden of infection is higher among low SES population, the low socioeconomic status population. It's a higher burden, but occasionally you'll get cases where there's very, very few infections in that population at all. And then similarly for high SES cases, we may on average have a lower number, but there's also a distribution associated with them. These distributions come by running the model many, many times over and over again, running as we call an ensemble of realizations of the model. And in a given run of the model, you might see something like this, where, a set of runs. So a given run might be like this, and a set of runs we're accumulating over time in the darker areas of the space, which are down lower here, get many, many, many runs that lie in that area. whereas upper areas are more rare. So here we're running the model many times to get a sense of its behavior over time. And if we're interested in assessing the impact of interventions, we need to be aware of the fact that we will generally have distributions associated with the incremental gain of one intervention over another. The benefits of one intervention or another will be delineated by an intervention. Another feature of ABMs that we'll see a little bit in this boot camp, there'll be an optional session on this, is it's straightforward to build agent-based models that feature multiple aspects of context. So we can capture, for example, persons nested in neighborhoods, each associated with schools, with municipalities or country. Or we can capture individual deer in a herd within an ecoregion or within the broader population. So when it comes to agent-based models, we're not merely talking about atomistic individuals in a single population. We're talking about interacting individuals, often in one or more populations, and where there's often nested linkages or networked characteristics of those populations. So it's very common to have these models capture multiple populations and interactions between them. This sort of modeling can be very, very useful if you're working with things like multi-level statistics, hierarchical linear modeling, mixed effects methods, where you have some data at the higher level and some data at the individual level, and you're seeking to make sense of it with these sorts of models. And frequently, the emergent behavior will differ strikingly over different scales. So let me briefly highlight what I see as sort of notable strengths of agent-based modeling at an introduction. We're going to get more familiar with these over time, and I may go into a little bit more detail when we talk about hybrid models. One aspect that we saw from the very first example is the capacity to represent spatial context and the ability to represent situated network context is often of core interest when it comes to health issues. Whether it's due to spread of infection across a network of needle sharers, whether it's due to effects of a family context on health behavior associated with children, for example, nutrition and physical activity, whether it's due to whether you're interested in the spread of innovation among networks of providers. Networks are often of keen interest these days in understanding why we see certain patterns. Some interventions these days on the health side seek to build up networks, sometimes termed complex interventions. They seek in the design of the intervention to strengthen social capital, to bring people together who would otherwise be separate, and to really understand the effects of those interventions, the effects of changing the network structure on people's subsequent health trajectories. Capturing networks is often of great interest. Spatial phenomena are also central interest, needless to say, whether it goes in the area of environmental epidemiology, the area of health disparities, and the fact that people in different areas have very different levels of access to care, very different levels of social determinants of health, supporting their health behaviors, etc. And all of these correspond to sort of big motivations for use of this modeling. More broadly, the capturing of other types of heterogeneity, both continuous and discrete, is of great interest in health. So being able to understand the effects of for example, the effects of ethnicity in shaping people's outcomes with respect to access to resources, with respect to opportunity structures. Often of strong interest. We know that in many cases it's most effective to target health interventions based on characteristics of people. You can get greater bang for the buck by targeting sometimes those who are most vulnerable or those who are disproportionately important in shaping the evolution of health status of the population as a whole. And that may not mean an immediately obvious set of people. But capturing heterogeneity is often of keen interest when it comes to understanding the effects of interventions because of transfer effects where we may favor one group as opposed to another, and to be able to target our interventions effectively, to target them with greatest cost effectiveness. Another motivation for these sort of models is in capturing situated decision-making in learning. If we want to capture, on the part of agents, their experiences over time and the ways in which those might affect their choices going forward, the ways in which their preferences might change over time, the ways in which their encounters with the healthcare system might, for example, predispose them to further encounters or to avoid further encounters or to switch providers. We can do this far more readily at an agent-based level than we can at an aggregate level, and that we can by sort of trying to shoehorn it into a discrete event model. And here, often the situated decision-making is based on their spatial context and their network connections, the fact that they interact with others, gain understanding from them. So this is a big motivation for agent-based modeling in health as well. The whole area of longitudinal information is, I think, particularly key, particularly for areas where we're seeking to adopt a life course approach, where we're seeking to understand the effects lifelong of early life insults on later life trajectories, of early life exposures on how people's outcomes evolve over subsequent decades. A longitudinal perspective is often key. Often we have data sets that are longitudinal. We want to make sense of them with a model that will capture longitudinal information. I had noted earlier that in a stock and flow model, such as this one here, we don't really capture the trajectories of individuals. We get a cross-sectional depiction of the population over time. At any one time, we know the number of people who are susceptible, exposed, infected, and recovered, and we got a time series associated with it. But we can't really effectively ask questions at the individual level concerning their biographies, their experiences over time. By contrast, that's a potent motivator for the use of agent-based models. The ability to match to longitudinal data, the ability to capture the patterns that are expressed in our longitudinal data. These are very important motivators. And I would highlight for interventions the ability to shape an intervention based on the history of a person, say the history of a patient, or the history of an individual in terms of past health behaviors, past encounters with the healthcare system. This can be a very potent formulation for effective interventions. So it's an aspect of heterogeneity that merits its own little discussion. And in the course of this boot camp, we'll be seeing how we can instrument people in our models to accumulate information on their biography, their particular experiences, when they were first exposed to an idea, or at what point they developed a certain health condition. So if we're thinking about synthetic data sets and comparing what the agent-based model produces against real data, this will be very valuable, and we'll see how we can do it with the models. Agent-based models often allow us to more precisely characterize the effects of interventions within a model. Not just because we can build in things that depend on people's longitudinal histories or depend on their heterogeneity, but also because we can characterize their choices over time as the emergent result from changes we make in the model. Maybe it's setting incentive systems in the model. Maybe it's putting in place penalties in the model. Maybe it's changing the tax structure to discourage people from use of tobacco products. We can examine the implications of that endogenously within the model, rather than simply imposing an assumption about how people's behavior will change. And that's a result in large part because we can capture decision-making. And as time allows, and as participant interest allows, Jeff or I may be talking in the course of this boot camp about how you can mesh sort of agent-based models on the one hand with choice models of how people tend to choose things in a cognitively realistic way, where you can understand the impact of different choice sets over time if you gave them additional choices, if you were to change the nature of their environment, if you were to change the the costs associated with different options, how would that affect their behavior? We could capture that within the model rather than presupposing it, rather than having to simply say, change this parameter to assume less uptake of cigarettes. We could see how that emerges from changes in the laws regulating minor access to cigarette, regulating advertising and promotion by cigarette companies, or regulating or on the side of tobacco-related taxes. The models that we've seen can have very potent visualizations. You've seen an example of one visualization now, somewhat modest in character. But these models can very readily be associated with visual interfaces that are quite compelling. This is not merely eye candy, ladies and gentlemen. On a number of projects I've been involved with, while I was initially skeptical, the recourse to effective visualization of my model has opened up substantive insights for me that eluded me during months and months of work with the quantitative data, with the columns of numbers that were coming out of my other models. Once I saw it visually, within 10 minutes I was able to zero in on something that had eluded me for months. This is not a minor factor for the modeler, and it's not a minor factor for the stakeholders. Most of the modeling projects we work with, and probably most of those that you would consider, are conducted in an interdisciplinary context with many who have no interest or inclination to get involved in the details of the model. They're people for whom confidence about the model will be very important for effecting change, but where they're unlikely to dig into all the assumptions within the model. And effective visualization can be very important for communication with those stakeholders, as it can be with broader communities affected by the model. The final aspect I'll mention here, and this is one we've used to good effect in a number of our experiments, and I'd be glad to talk about if there were interest, is there's a growing use of the model. It's not common, but it's growing use of these sort of models, these agent-based models, as providing sort of a micro-world for testing out statistical strategies, biostatistical strategies, testing out strategies associated with study design, for design of epidemiological studies, because they allow you to specify things in the model that might plausibly depict the situation you're seeking to investigate, and understand the ways in which different study designs or different measures on the population might be more or less effective given the underlying characteristics of the population in understanding those underlying health state of the population. So here we have kind of God's eye view on the model. We kind of have a complete understanding of what's going on in the model, and then we see the degree to which different measures and different studies actually allow us to pick up what's going on in the underlying model and people's health behavior, et cetera. So here we're using the model kind of as a tool for refining other tools in our toolbox, biostatistical techniques, epidemiological study designs, and population-wide statistical measures that we might want to use in the field, and which we first test out in silico with our synthetic models. Okay? So these are a set of notable attractions for agent-based models. Are there any questions about these before I go on to a brief look at some of the aspects of the modeling process? Yeah? Oh, okay. What I meant by that, it's a good question. So, and this is a question that Dr. Jeff McDonald back here in the corner was instrumental as in so many things in sort of alerting me to the substantive weighty issues here. So the issue here, Sarah, is that when if we're interested in undertaking modeling of many health issues, a very potent consideration is not only how they affect the health of the entire population, but the way in which they differentially affect the health status of different subpopulations, okay? And the concern here is there may be certain interventions that at a first appearance, if you look at them at an aggregate level, they would appear to be favorable. Perhaps they're favorable in the sense of overall health gain, perhaps in the sense of cost effectiveness, but they appear attractive at first glance. The issue is that if you're not careful to capture heterogeneity in the model, the fact that there are these different groups, we may be implicitly imposing value judgments on this model by essentially saying, well, you know, if you benefit group A and disadvantage group B, you know, they're of equal concern. So if A is benefited a bit more, it's still a net gain. Whereas often in our policymaking and in our health efforts, we're seeking to build in not only valuing net gain, but also health equity considerations. We don't want to worsen disparities within the population. And there's a history of interventions, and if people are interested, I'd be glad to give references, where there's been a net gain for the population as a whole, but where health equity has actually been worsened by the intervention. And again, if you have an aggregate model and you're not representing heterogeneity, it kind of, you view it as coming out in the wash. That's imposing a value judgment. That's imposing, we don't really care about those health equity effects. What we care about is the net effect. And that can be fraught with danger, you know, giving recommendations based on that. In an agent-based model is very, it's straightforward to add in representation of heterogeneity to the model, and we can do so, therefore, very flexibly in the course of the modeling project. Within an aggregate model, let's suppose that model earlier that we were which we were looking, that model associated with, you know, again, very stylized, but it will communicate the point. This model, if we built this model, and then we say, you know, we're really interested in understanding the differential effects of our intervention on males and females. We have this model for the population as a whole. Let's suppose that we wanted to capture it for males and then for females so we can understand the differential effects, or maybe for different ethnicities, right? Okay, so suppose we want to capture it for males, females, and we want to build those in. We would build in, we'd basically take this model and we would so-called disaggregate it by males and females, and that would mean turning each of these stocks into two stocks, right? And that would be a change that affects the whole model. It's the entire model that would have to be changed. Each and one of these stocks, each and one of these flows here would have to be updated as a result. By contrast, adding sex as a characteristic into an agent-based model is a matter of placing a parameter in there. We don't have to change the whole model. It's a very surgical operation. So now we doubled the size of our model by introducing, you know, sex. Maybe later, you know, 6 months later, we decide, well, ethnicity is really, it's really turning out to be very important in some of the population statistics we're seeing. Let's factor that into our model. Now we're talking about, again, modifying the whole darn model, and we're talking about multiplying it by maybe a factor of 5, you know, say Caucasian, African American, Hispanic, Asian Pacific Islander, and North American Indian. And so now we multiply it by another factor of 5, and we have to modify the whole model. So not only is it cumbersome, it's very time-consuming, very delicate, and often error-prone to modify in that way. But the danger is if we don't capture those things, we may be glossing over, glomming together the health effects and just assuming it comes out in the wash. Whereas maybe there's profound transfer effects, cases where we benefited the already advantaged population and really done almost nothing or disadvantaged the vulnerable population. Is that helpful? Very helpful. Okay, great question. Any other questions related to this? Okay, so just taking a look at some strong features associated